The health and social care system in the United Kingdom is one of the most comprehensive and publicly funded systems in the world, providing universal healthcare to all citizens and residents. It is characterized by a strong emphasis on equity, accessibility, and quality, with services largely funded through taxation. The system is primarily organised and delivered by the National Health Service, NHS, in England, Scotland, Wales, and Northern Ireland, each with its own structure and governance. Structure of the NHS and healthcare services. National Health Service, NHS, overview. The NHS, established in 1948, is the world's largest publicly funded health service and is often regarded as a cornerstone of British society. It operates under the principle that healthcare should be free at the point of use, based on need rather than the ability to pay. The NHS is funded primarily through general taxation and national insurance contributions. NHS England, overseen by the Department of Health and Social Care, NHS England is responsible for the management of the health service in England. It sets national health policies, allocates funding to clinical commissioning groups, CCGs, and ensures that services meet national standards. England's NHS provides a wide range of services, including primary care, secondary care, tertiary care, mental health services, and emergency care. NHS Scotland. NHS Scotland is the publicly funded health service in Scotland, overseen by the Scottish Government's Health and Social Care Directorate. It operates a similar structure to NHS England but has autonomy in setting health policies, managing funding, and delivering services tailored to the needs of Scotland's population. NHS Wales. NHS Wales is overseen by the Welsh Government and provides health services across Wales. Like NHS Scotland, it operates with considerable autonomy, focusing on policies and programmes that reflect the specific health priorities and challenges of Wales. Health and Social Care, HSC, Northern Ireland. In Northern Ireland, the NHS is integrated with social care services and is known as Health and Social Care, HSC. The Department of Health, Social Services, and Public Safety, DHSSPS, manages health and social care services, which are delivered through health and social care trusts. Primary care. Primary care is the first point of contact for patients within the NHS and includes general practitioners, GPs, dental services, pharmacists, and optometrists. General practitioners, GPs. GPs are the backbone of the NHS, providing diagnosis, treatment, and referrals to specialist care. They also play a crucial role in preventive healthcare, managing chronic conditions, and coordinating patient care. Most GPs operate in independent practices contracted to the NHS, while some work in NHS-owned clinics. Pharmacies. Community pharmacies provide essential services, including dispensing medication, offering health advice, and providing vaccinations. The NHS works with pharmacies to promote public health initiatives, such as smoking cessation and weight management programs. Dental and optometry services. NHS dental services provide preventive and restorative care, including checkups, fillings, and extractions. Optometry services, often provided by high street opticians, offer eye tests, prescriptions for glasses or contact lenses, and referrals to ophthalmology specialists. Secondary and tertiary care. Secondary and tertiary care in the UK involves more specialised medical services, often delivered in hospitals or specialised treatment centres. Hospitals. NHS hospitals provide a wide range of services, including emergency care, inpatient and outpatient services, surgery, maternity care, and specialised treatments. These services are delivered by a range of healthcare professionals, including doctors, nurses, therapists, and support staff. Specialised services. Tertiary care refers to highly specialised treatment, such as cancer care, neurosurgery, and organ transplants. These services are often concentrated in specialist hospitals or units that serve a wider geographical area. Accident and emergency, A&E. A&E departments provide 24-hour emergency care for serious and life-threatening conditions. The NHS is committed to meeting the 4-hour target, which aims to treat, admit, or discharge patients within 4 hours of arrival in A&E. Mental health services. Mental health care is an integral part of the NHS, providing services for people with mental health conditions, including anxiety, depression, schizophrenia, and bipolar disorder. Community mental health teams, CMHTs. CMHTs provide support to people with severe or complex mental health needs, offering a range of services, including therapy, medication management, crisis intervention, and rehabilitation. These teams consist of psychiatrists, psychologists, social workers, and nurses who work collaboratively to support patients. Psychological therapies. The NHS offers a range of psychological therapies, including cognitive behavioral therapy, CBT, counseling, and psychotherapy, available through the Improving Access to Psychological Therapies, IAPT, program in England. These services are provided free of charge and are designed to help people manage common mental health problems. Inpatient and crisis services. Inpatient mental health units provide care for individuals experiencing acute mental health crises or requiring intensive treatment. Crisis services, including crisis helplines, home treatment teams, and crisis houses, are available to provide immediate support. Social care services. Social care services support individuals who need help with daily living activities, such as bathing, dressing, and cooking, due to age, disability, or long-term conditions. Elderly and disability care. Local authorities are responsible for assessing individuals' needs and providing social care services, which may include residential care, home care, day services, and equipment to help people live independently. Services are means tested, meaning people may have to contribute towards their care costs based on their income and savings. Integration with health services. There is a growing emphasis on integrating health and social care services to provide seamless care for individuals, particularly those with complex needs. Integrated care systems, ICSs, are being developed to bring together NHS organisations, local authorities, and community groups to coordinate care and improve health outcomes. Key features and principles of the NHS. Free at the point of use. One of the core principles of the NHS is that healthcare is free at the point of use for all residents of the UK. This means that most services, including GP visits, hospital care, and emergency services, are provided without direct cost to patients. Some services, such as dental care, prescription medication, and optical care, may require a co-payment, but exemptions are available for children, the elderly, and those on low incomes. Universal access. The NHS provides universal access to healthcare services for all UK residents, regardless of income, social status, or geographic location. The aim is to ensure that everyone has access to high-quality care based on the clinical need, rather than their ability to pay. Equity and quality. The NHS is committed to providing equitable care for all patients, ensuring that everyone receives high-quality services regardless of their background or circumstances. The Care Quality Commission, CQC, is responsible for inspecting and regulating healthcare providers in England to ensure they meet quality standards. Similar regulatory bodies exist in Scotland, Wales, and Northern Ireland. Comprehensive range of services. The NHS offers a comprehensive range of services, from preventive care and health promotion to acute treatment, rehabilitation, and palliative care. The aim is to provide a holistic approach to healthcare, addressing physical, mental, and social needs. Patient choice and empowerment. The NHS promotes patient choice, allowing individuals to select their GP, choose where to receive hospital treatment, and access specialist services. Patients are encouraged to participate in decisions about their care, and shared decision-making is increasingly recognised as a key component of patient-centred care. Challenges facing the health and social care system. Funding and resource pressures. The NHS faces significant funding and resource pressures, with demand for services outpacing the available resources. Factors contributing to these pressures include an aging population, rising rates of chronic conditions, advancements in medical technology, and the need for continued investment in infrastructure and workforce. Aging population. The UK has an aging population, with increasing numbers of people living longer and requiring more complex care. This has placed pressure on health and social care services, particularly in areas such as geriatrics, long-term care, and end-of-life care. Chronic conditions. The prevalence of chronic conditions, such as diabetes, heart disease, and respiratory illnesses, has increased, driving up demand for healthcare services. Managing these conditions requires long-term, coordinated care, often involving multiple providers and settings. Workforce shortages. The NHS faces workforce challenges, including shortages of doctors, nurses, and other healthcare professionals. Recruitment and retention difficulties are exacerbated by factors such as burnout, Brexit, and competition from other countries for skilled healthcare workers. Health inequalities. Despite the principle of universal access, health inequalities persist across the UK, with significant disparities in health outcomes based on factors such as socio-economic status, ethnicity, geography, and gender. Socio-economic inequalities. People living in deprived areas tend to experience poorer health outcomes, higher rates of chronic illness, and shorter life expectancy compared to those in more affluent areas. Addressing these inequalities requires targeted interventions, investment in public health, and policies that address social determinants of health. Geographic disparities. Access to healthcare services varies across regions, with rural and remote areas often facing challenges related to distance, transport, and workforce availability. Efforts to improve digital healthcare, telemedicine, and integrated care aim to address these disparities. Impact of Brexit and COVID-19. Both Brexit and the COVID-19 pandemic have had significant impacts on the health and social care system in the UK, creating new challenges and necessitating adaptations. Brexit. The UK's departure from the European Union has led to changes in workforce availability, particularly among healthcare professionals from EU countries. The NHS relies heavily on international recruitment, and Brexit has exacerbated existing workforce shortages. Additionally, there are concerns about the impact of Brexit on access to medicines, medical devices, and research funding. COVID-19 pandemic. The pandemic placed unprecedented strain on the NHS, with increased demand for critical care, challenges in managing elective procedures, and the need for rapid adaptation to new models of care. The NHS responded by expanding intensive care capacity, rolling out mass vaccination programs, and adopting digital health solutions, such as virtual consultations and remote monitoring. Integration of health and social care. Integrating health and social care services remains a significant challenge in the UK. The division between health, funded by the NHS, and social care, often means tested and funded by local authorities, can lead to fragmented care, delayed discharges, and unmet needs. Integrated care systems, ICSs. The UK government is promoting the development of integrated care systems, ICSs, to bring together NHS organisations, local authorities, and community partners to deliver more coordinated and holistic care. ICSs aim to improve collaboration, reduce duplication, and focus on prevention and early intervention. Recent developments and future directions. Digital health and innovation. The NHS is embracing digital health technologies and innovation to improve patient care, increase efficiency, and address resource challenges. Telemedicine and remote monitoring. The COVID-19 pandemic accelerated the adoption of telemedicine, with a significant increase in virtual consultations, remote monitoring, and digital health platforms. These technologies offer new opportunities for patient engagement, access to care, and management of chronic conditions. Artificial intelligence, AI, and data analytics. The NHS is exploring the use of AI and data analytics to enhance diagnostics, treatment planning, and population health management. AI tools are being developed to support radiology, pathology, and early detection of diseases, while data analytics is used to identify patterns, trends, and risks in patient populations. Electronic health records, EHRs. the NHS is working towards the implementation of integrated electronic health records across the UK, enabling better coordination of care, sharing of patient information, and data-driven decision-making. EHRs improve the continuity of care, reduce duplication, and support more personalised care planning. Focus on prevention and public health. There is a growing emphasis on prevention and public health within the NHS, recognising the importance of addressing the root causes of ill health and reducing demand for acute services. Public health campaigns. The NHS and public health authorities run numerous campaigns to promote healthy behaviours, such as smoking cessation, healthy eating, physical activity, and mental well-being. These campaigns aim to reduce the burden of preventable diseases and improve population health outcomes. Personalised prevention. Personalised prevention approaches, such as genetic testing, tailored lifestyle advice, and digital health tools, are being developed to help individuals understand their risk factors and make informed health choices. Addressing mental health and well-being. The NHS is prioritising mental health as a key area for investment and improvement, aiming to achieve parity of esteem between mental and physical health. Mental health investment. The government has committed to increasing funding for mental health services, expanding access to talking therapies, crisis services, and community-based care. The NHS long-term plan includes specific targets for improving mental health outcomes, reducing waiting times, and supporting early intervention. Workforce expansion. Efforts are underway to recruit and train more mental health professionals, including psychologists, psychiatrists, and mental health nurses, to meet growing demand and improve service provision. Improving social care and support. Addressing the challenges in social care is a critical priority for the UK government, with calls for reform to ensure sustainability, equity, and integration with health services. Social care funding reform. The government has proposed a new funding model for social care, including a cap on care costs and changes to the means test. These reforms aim to provide greater financial protection for individuals, improve access to care, and reduce the financial burden on local authorities. Integration with health services. The integration of health and social care remains a key focus, with initiatives to improve collaboration, data sharing, and care coordination. The development of integrated care systems, ICSs, is expected to play a pivotal role in achieving this integration. The health and social care system in the United Kingdom is facing significant challenges, but it continues to adapt and innovate to meet the needs of its population. Through investment in digital health, integrated care, prevention, and workforce development, the UK aims to build a resilient, equitable, and sustainable system for the future.